Gonorrhea, one of the oldest known sexually transmitted diseases, has been recognized since ancient times. The first recorded description of an illness that is consistent with gonorrhea appears in the Bible, in the book of Leviticus, written around 1500 BC. However, the disease was more clearly described by the Greek physician Galen in the 2nd century AD, who coined the term gonorrhea, flow of seed. The bacterium that causes gonorrhea, Neisseria gonorrhoeae, was identified much later. It was first described by Albert Neisser in 1879, who observed the bacteria in a microscopic examination of urethral discharge from a patient suffering from gonorrhea. This discovery established the bacterial nature of the disease and differentiated it from other conditions with similar symptoms. Gonorrhea is a sexually transmitted infection, STI, primarily spread through sexual contact, caused by the bacterium Neisseria gonorrhoeae. The most common way this infection is transmitted is through sexual activities, including vaginal, anal, and oral sex. The bacterium responsible for gonorrhea can infect the mucous membranes of the genitals, rectum, throat, and eyes. It's particularly noteworthy that gonorrhea can be transmitted by an infected person even when they do not exhibit visible symptoms. Another significant route of transmission is from mother to child during childbirth. Pregnant women who are infected with gonorrhea have a risk of passing the infection to their baby. This vertical transmission can lead to severe health issues in newborns, such as blindness, joint infections, or even life-threatening blood infections. While much less common, there are instances where gonorrhea can be transmitted through means other than sexual contact. For example, the sharing of sex toys that have not been properly cleaned or covered with a new condom each time they are used can potentially spread the infection. However, it's important to understand that gonorrhea is not spread through casual contact. Therefore, it cannot be contracted from sharing bathrooms, towels, bedding, swimming pools, or eating utensils. Due to the modes of transmission and the potential for asymptomatic cases, particularly among women, practicing safe sex, including the consistent use of condoms, is crucial. Regular screenings for STIs are also recommended for sexually active individuals. This is important for early detection and treatment, which are key in preventing serious health complications and limiting the spread of the infection to others. Gonorrhea is a sexually transmitted infection that often presents with distinct symptoms in men and women, though it's important to note that many individuals with gonorrhea may not experience any symptoms, particularly in the early stages of the infection. In men, gonorrhea can cause a burning sensation during urination and a pus-like discharge from the penis, which may appear white, yellow, beige, or greenish. Some men may also experience painful or swollen testicles, although this is less common. For women, the symptoms of gonorrhea can include an increased vaginal discharge and painful urination. Women may also experience vaginal bleeding between periods, including after intercourse, and pain during intercourse, as well as pelvic pain. Gonorrhea can also infect the rectum in both men and women, regardless of sexual orientation or the type of sexual activity engaged in. Symptoms of a rectal infection can include discharge, anal itching, soreness, bleeding, and painful bowel movements. Additionally, if gonorrhea infects the throat, which can happen through oral sex, it might cause a sore throat. However, many people with oral gonorrhea do not exhibit any symptoms. It's crucial to be aware of the potential long-term consequences of untreated gonorrhea. In women, the infection can spread to the reproductive organs, leading to pelvic inflammatory disease, PID, which can cause infertility and an increased risk of ectopic pregnancy. In men, gonorrhea can lead to painful inflammation in the tubes attached to the testicles and can also result in infertility. Given that gonorrhea can be asymptomatic and yet lead to serious health issues if left untreated, regular screening and prompt treatment are vital, especially for sexually active individuals. Anyone who suspects they have been exposed to gonorrhea or is experiencing symptoms should seek medical evaluation and treatment. Treating gonorrhea effectively requires a specific approach due to the bacterium Neisseria gonorrhoeae's increasing resistance to antibiotics. The treatment typically involves a combination of antibiotics, often recommended by health authorities like the Centers for Disease Control and Prevention, CDC. The standard treatment for gonorrhea usually includes a dual antibiotic therapy. This approach generally involves an injection of an antibiotic, such as ceftriaxone, combined with an oral antibiotic, like azithromycin. The injection targets the gonorrhea infection, while the oral antibiotic is often included to treat any potential co-infection with chlamydia trachomatis, as these two infections frequently occur together. After receiving treatment, it's important for patients to have a follow-up consultation with their healthcare provider. This step ensures that the infection has been completely cleared, especially considering the rise in antibiotic-resistant strains of gonorrhea. Another critical aspect of managing a gonorrhea infection is notifying all recent sexual partners. Informing partners allows them to get tested and, if necessary, treated, which helps prevent the spread of the infection and reduces the risk of reinfection. Patients undergoing treatment for gonorrhea are advised to abstain from sexual activity until both they and their sexual partners have completed their treatment and are confirmed to be cured. This precaution is essential to prevent the spread of the infection. Regular screening for sexually transmitted infections is recommended for sexually active individuals, particularly those with multiple partners or those who do not consistently use condoms. This practice helps in early detection and treatment of STIs, including gonorrhea. Completing the full course of prescribed antibiotics is crucial, even if symptoms disappear, to ensure the infection is fully eradicated. Self-treatment or the use of over-the-counter medications is not advisable, as these methods may not effectively treat the infection and can contribute to antibiotic resistance. In summary, treating gonorrhea involves a combination of prescribed antibiotics, follow-up care, partner notification, abstaining from sexual activity during treatment, and regular STI screenings. These measures are essential to effectively treat the infection, prevent its spread, and tackle the challenge of antibiotic resistance.